What happens during a plastic surgery consultation? So everybody wonders why they need a plastic surgery consultation, but really ultimately it's one of the most important things just to make sure that you are a good candidate for the procedure that you are seeking. The other thing is we need to have a conversation. I always assess someone's health history to make sure they don't have medical problems that can make surgery risky. I'd love to have a conversation with the patient so I can see what they're after and just to make sure that my expertise can satisfy their expectations. So we always have to make sure that the expectations that the patient has are realistic, because you don't want to embark or go through a whole procedure and be disappointed with the outcome. And the reality of the situation is we are not magicians. And so you and your qualities and your characteristics have a role in what your final outcome may be. So you're never going to look like someone else. You're never going to be perfectly symmetric. You're going to be a significantly improved version of yourself. So during the consultation, we assess all those things. We determine what will work best for you, and what your goals are and what procedure or combination of procedures are going to be best. And then at that point, we also go over cost, which is ultimately significantly important for you to make sure that it's affordable for you. We go over before and after instructions and then the whole scheduling process. So usually we'll provide instructions on what blood work we need. Sometimes we need mammograms for certain breast surgery. Sometimes we need EKGs for people who are over 50. So various testing is recommended, and we give people lab slips for that. And then we proceed with all the scheduling. And so we work out like what surgery day you're gonna have. And also we do an extensive preoperative visit about 1 to 2 weeks in advance. So the consultation is very, very important. We do a lot of people who fly to Las Vegas for plastic surgery and fly in from out of town. And so sometimes what we'll do is we'll do like a phone call first with an assessment of some photographs. But photographs or a phone call or a Zoom call are no substitution for an in-person examination, because there are certain things that you can see and feel on exam that just are not going to show up in a photograph. So ultimately, that in-person consultation is always required before we plan on doing surgery with an individual and making sure that they're the right fit for the practice as well.